When we think about the civil rights movement in America, we often think of its amazing leaders: Martin Luther King Jr., Rosa Parks, Malcolm X. But a place we don't typically look to as the catalyst for change is the healthcare system. In fact, on a macro level, no one group of people has done more to drive social change in our country than healthcare professionals. And during the late 1960s, one of the physicians at the front lines of change was Dr. Dan Blumenthal.
Well, it all starts with the war in Vietnam. I was among the many people who thought that the war in Vietnam was just wrong, and I refused to participate in it. I claimed conscientious objector status, but I was turned down on that. So my wife and I decided that maybe VISTA was a route to go. We applied to and were accepted into VISTA and sent to this small town. This was Lee County, Arkansas. And at the time, it was said to be the 7th poorest county in the country. And the population was about 60% black, 70% poor. A very small, rural, southern, segregated place. There was separate school systems. In spite of the majority black population, the county government was an all-white government, all-white power structure. There was a 25-bed hospital, and there were 4 other physicians there. We were engaged then in community organizing, and that's what VISTA was about at the time. And the beginning part of this was to organize neighborhood action councils. And these were found to be rather threatening by the white power structure in the county, because these were folks that were getting ready to do something. I then had the opportunity to visit each of them and pose the question, what can we do in terms of health care to make this county a healthier place? And I was naively, I guess, expecting to engage in some sort of public health project. But what I heard over and over again was, we need a place to go when we're sick. I had a visit with the medical director at St. Jude's Children's Hospital in Memphis, who said, well, why don't you just start by making house calls? So that's what I did. And for a couple of months, I was practicing medicine out of my car. There were basically 2 paved roads, one going north-south and the other one going east-west, and everything else was a gravel road or a dirt road. And when it rained, the dirt roads turned to mud. And I got stuck in the mud any number of times. There was a federal program at that time called the Emergency Food and Medical Services. And a couple of us went to visit the director of this office in Washington, and he said, well, send us a proposal and maybe we can award you some money as a grant so you can get this thing started. So we did that. I wrote my first grant proposal and got a grant for $35,000, something like that. Healthcare was free. We put out a box and said, if you can, drop some money in the box. At this point, it was recognized what we were up to. The 80-year-old physician remarked to a newspaper reporter at one time how awful it was that these VISTA volunteers were going around to black churches encouraging people to stand up for their rights. And he was deeply offended by this. Then, because it seemed that there was some ill will being generated somewhere, the churches in town decided to do a special service honoring the physicians of Marianna, Arkansas, but they didn't invite me. I think it was an assistant to the governor that discovered that all this was going on and called a reporter, and at that point, this actually became a national story. We then found a young man named Ollie Neal. And it was, I would say, largely because of Ollie's outreach efforts that there developed a political movement that became separate from the health care operation. This political movement rolled on, and the first black candidates for public office were on the ballot. Then things got a little testier. There was a school boycott in support of what I'd call educational justice. There was a business boycott in support of economic justice. A lot of businesses in downtown Marianna went out of business because of the boycott. There eventually became a black county judge, a black sheriff, Lee County is still poor. The poverty rate has dropped from about 70% to a mere 35%. The clinic became a federally funded community health center. They built a new building. It's still there. It's still a federally funded community health center. So they soldier on, facing the usual difficulties that similar facilities have in low-income, minority, rural areas. But they are surviving, they are providing medical care, and it has, to this point, a happy ending, I would say.
Dr. Blumenthal and his wife left Lee County in 1970 and moved to Atlanta, Georgia. But his community organizing efforts didn't stop there. Following his experience co-creating a healthcare system with and for the community it served, he began looking for ways to put the same kind of system in place in similar low-income communities in the Atlanta area.
Until I retired, I have been working at Morehouse School of Medicine. I was there for about 35 years. And we developed a number of programs. And perhaps the most representative of these partnerships is at our Prevention Research Center, which is funded by a federal grant. And the Prevention Research Centers are required to have community advisory boards. But we said we're not going to have a community advisory board, we're going to have a community coalition board. And the coalition is a coalition of academic institutions, Morehouse, Emory, Georgia State University. Morehouse is the lead academic institution. There is a long history of exploitation of minority communities by what I'll call establishment institutions. And so people from universities have largely become unwelcome in low-income minority communities with the whole set of social problems that you might imagine. Drugs, violence, school dropouts, poor housing, a lot of the problems of poverty and discrimination. So there was a process that developed over a period of years, really, some trust because of this history of exploitation.
While much of his work has been within the medical field, Dr. Blumenthal's efforts have reached far beyond medicine and into both community and social activism.
I would consider myself an activist, and I think that's a good thing, and I think we need more activists who are working on the right side of issues. We do have a political system in this country, and public health is political, healthcare is political, and if we're not involved in that, then in a sense we have no right to complain about the way the healthcare system is functioning or the fact that the city, the state, the country is not serving the people in the way that it needs to serve them.
It's not hard to see how important people like Dr. Dan Blumenthal have been in changing the social climate in our country. And while it may sometimes seem like we have a long way to go, he has been, and always will be, optimistic about the future.
There's no doubt that we've made progress. I mean, in the 60s, people were marching for voting rights, and even though there are problems with voting now, we certainly have greater access to the ballot box now for many people than we did back then. Official segregation, de jure segregation, is clearly a thing of the past, even though housing is still segregated and consequently schools are still segregated in many ways, but at least there's no laws requiring that anymore. Things have moved in the right direction, but they move slowly, and we have setbacks along the way. But when you look at the long sweep of history, there is no doubt that we are moving in the right direction. And I think it is when people become passive that it provides an opportunity for people who ought not to be in control to get in control. And then we slip backwards, and then there's a response to that, and once again we move forward. You know, I was a participant in a ceremony recently where the county commissioners were handing out citations and recognitions to people who had done important things. And one of the recipients was an African-American man who had been riding in a bus when the bus driver had a heart attack and died as he was driving the bus. And this guy jumped out of his seat and took over and kept the bus from running into a truck that it was about to run into and steered it to safety over to the side of the road. And so he was being recognized for his heroism, really, in saving all the passengers on the bus, not to mention whoever was in the truck that they didn't run into. And it occurred to me that if this guy had been sitting in the back of the bus, he couldn't have done what he did. And so, in a very small way, that's a symbol of how far we have come in the 50 years since Martin Luther King was assassinated. And as he said, the arc of the moral universe is long, but it bends toward justice. It is a long arc, and things do change slowly, and sometimes we have little setbacks, but in the long run, we are moving toward justice.